I want to tell you guys a story about a palliative care patient that I think explains our services pretty well. I'm a palliative care social worker and I work with patients in the outpatient setting. I see patients in the office and on Zoom, and a lot of times I'm working with families. So this is a patient that was in a lot of pain. He was going in and out of the hospital, going in more and more, and no longer able to eat, and was starting to lose his ability to communicate. Eventually, he couldn't make decisions for himself. When he was still able to make decisions, it was very clear that quality of life was super important to him. Having a sense of being able to be a normal person, to be around his family, and to do the things he loved made all the difference. But his oncologist kept giving him more and more treatment options, and it was hard to say no to. He didn't want to let his family down. He didn't want to disappoint them. So he kept on going. The treatments weren't working, and the oncologist would throw something else out there. Meanwhile, he was going to the hospital more and more, and it was just clear that he was sick. At the point of time where he stopped being able to make decisions for himself, my team contacted the wife and had a conversation, what we call a goals of care conversation. Her goal was to help manage his pain and to help him maybe gain more weight and things like that. And we stopped her and said, you're focusing kind of in the weeds here. Let's rise above and look at the bigger picture. What do you really want for him? What does he want? And she said he wishes that he was home. He wouldn't want to be in the hospital all the time. So there's ways to manage the pain and the other symptoms in the home, which would be moving towards hospice care. But that was a scary word for her. She wasn't ready to let him die. She wasn't ready to let him go. The problem is that his body was doing what it was going to do anyways, and we had no control over it. So the conversation was not, what can we do to keep him alive? It's what can we do to help him die in a death that he wants to have, that the family would want to have. And once we were able to talk about that, it's a really hard conversation, but it was helpful and meaningful for her so that she realized if he is dying, maybe we should get him home and go on hospice so he can be around the family, can be in his own bed and, be in a comfortable place. He ended up dying at home with his family by his side. And it was a very meaningful experience for them to be with him in those final moments. Also, I think it will help their grief a lot because they were able to have a peaceful ending rather than continue all the treatments they can in the hospital. They were talking about giving him feeding tubes and more chemotherapy and all these things. And the death may not have been as peaceful as it was. So palliative care can really help with making decisions, looking at the bigger picture and what's important. Ultimately, it's about the patient voice and what the family wants, but it should start with the place of who the patient was 10 years ago or 5 years ago, the person that would make decisions looking above saying, would I want all these extra treatments if it's not going to buy me more time and could cause suffering for me and my family? So think about yourself as a person without the illness, what you would want for yourself. That can help you give some perspective.